بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما يا أكرم الأكرمين. My topic today is about thyroid imaging, reporting and data system, TIRADS, by ultrasound. In 2017, a white paper was released by ACR Committee on Thyroid Imaging with a standardized scoring system with guidance on fine needle aspiration and follow-up. In 2009, an evaluation of TNS called TIRADS, similar to the breast imaging reporting and data system BIRADS. In 2011, complemented this classification by adding one of the subtypes. Similar to BIRADS category, sonographic TIRADS classification as follows. Sonographic suspicious criteria for malignancy. We consider these are suspicious criteria for malignancy, hypoechogenicity, microcalcification, partially cystic nodule with eccentric location of the fluid portion and lobulation of the solid component, irregular margin, perinodular thyroid parenchymal infiltration, taller than wide intranodular vascularity associated with lymphadenopathy. TIRADS is classified as follows: T1 TIRADS type 1 normal thyroid tissue, type 2 benign lesions, type 3 probably benign lesion, type 4 suspicious and subclassified to 4A, 4B and 4C, which is increasing risk of malignancy, type 5 probably malignant lesion more than 80% risk of malignancy, type 6 biopsy proven malignancy. Type 1 TIRADS category number 1. It is the normal thyroid tissue by ultrasound as we see here. This is transverse section of the thyroid gland with homogeneous echo pattern, and this is the long axis longitudinal view with homogeneous echo pattern with no nodules with normal vascularity. Type 2 TIRADS. It can be subclassified to colloid type 1, which is a vascular anechoic region with echogenic specks, giving the appearance of comet tail appearance, artifact, vascular heterogeneous echoic nodule, non-expansile, non-capsulated with peripheral halo called type 2 colloid nodule, isoechoic or heterogeneous, non-capsulated with expansile vascular nodule called type 3 colloid nodule. And these conditions have 0% of risk of malignancy and the score is 0. Here is some example. Here you see type 2 TIRADS is simple cyst with no masses inside an echoic. This is here a solid nodule with central cyst in it, and this is also type 2 TIRADS. This is also type 2 TIRADS with macroscopic calcification and homogeneous nodule. And here this is type 2 also TIRADS with the spongiform nodule with acoustic enhancement posteriorly, and here type 1 colloid nodule with uh, aspects of hyperacuosity, giving the appearance of cometal appearance artifact, and this is colloid type 2 with surrounding by halo. Type 3 TIRADS, a probably benign lesion, and as we see here, this is hyperechoic nodule with homogeneous with homogeneous in echo pattern. Type 4 TIRADS can be subclassified to 4A, 4B, 4C. If it is for A, it is a score number 1, a score 2 for type 4B, and a score for 3 to 4 for type C. And this type has highest increased risk of malignancy ranging between 50 to 85. With type B, it is about 10 to 50%. With type A, it is about 5 to 10%. What are the criteria for considering type A, type B, type C, or TIRADS type 5? Solid component has a stiffness of nodule on elastography if it is available, markedly hypoechoic nodule, microlobulation or irregular in margin, microcalcification taller than wider in shape. If it is one criteria associated with the nodule as mentioned before, it is type 4A. If it is two criteria, it is type 4B. If it is 3 or 4 criteria, if it is type 4C. Or if it is all suspicious features mentioned previously, it is type TIRADS type 5. Here you see it. This is type thyroid RADS 4A, hypoechoic nodule with abnormal vascularity, and it is score 1. And here this is another hypoechoic nodule with microcalcification and boldly defined that nodule, and this is score type 2 of TIRADS 4B. And here this is another nodule well defined, little bit hypoechoic with increased vascularity, and this is type C. You see a regular nodule with microcalcification, and the anterior posterior diameter is more than the transverse diameter, and this is score 3. And this is another nodule, hypoechoic, irregular in outline, with AB diameter more than the transverse diameter with score 3. Type 5 thyroid RADS. It is all the criteria mentioned previously: solid component, hypoechoic, microlobulation, microcalcification, taller than wider, and associated with lymphadenopathy. Here, this is a nodule with microcalcification and boldly defined with thyroid tissue infiltration, and the AB diameter is more than the transverse diameter. And this is another nodule with increased vascularity with score 6. These are the recommendations for the FNA according to American Thyroid Association. In summary, thyroid RADS type 1 normal thyroid gland. Type 2, it is benign nodule as described and 0 malignancy and score 0. Type 3, it is probably benign with score 0. Type 4, there is increased risk of malignancy according to the subtypes. The most increased malignancy is subtype 4C, has an increased risk 50 to 85 percent of malignancy with the score 3 to 4, and type 5 it is a probably malignant nodule more than 80% risk of malignancy with the score 5 or higher, and type 6 thyroid bovine biopsy. وشكرا and thank you وقل ربي زدني علما سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الخبير. Thank you. Hoping this will help you in daily practice.